And it's great to see everybody here, and I'm sorry there's been miscommunication. They told me news. And I have another Michigan group to go speak to. But I'm really honored to see so many people, not only from Michigan State. I'm wearing green today, sort of for Michigan State, for St. Patty's Day. And I want Michigan State to do really well and go all the way to the regional finals, but then I want the University of Michigan to beat Michigan State. Only joking, sort of. No, I'm not. And for those of you who aren't basketball fans, this is a good time to find a mental health escape and watch basketball. It really is an honor to see Michigan State here in the nation's capital talking about these issues. I have spoken to this conference before I was a member of Congress and after I was a member of Congress. And to celebrate the 10th anniversary of this conference is really, really, really important. And to watch from the very first conference to see the kind of participation that's here today and the understanding of the importance of talking about these issues. Some very memorable moments for me have been watching some of the imams when you did the faith-based and you encouraged the imams to come, and the kind of engagement that came on some of the subjects that people are uncomfortable talking about. You really, really are making a difference. So I can't tell you how great it is to see you here talking about these issues. I think most of you know who I am, but I do represent Dearborn. I've got the largest population of Muslims in the country, reside in my district, and I'm very, very proud of that. And my relationship with this community is very important to me. But I live across from the largest mosque in North America too, so it's also important to me. And I have watched what's happened in this community for the last 18 months. And I thought that this discussion was really important 10 years ago when you had the first one. And the stress that I am watching in this community in the last year. Children. You know, the first time that this happened to me was a year ago, January, when a fifth grader said to me that they were afraid that someone is going to come knock on their door, pull their family from their house, and that they were going to disappear, and no one was ever going to know where they were. But I didn't hear that story once. I've heard that from probably 30 children over the course of the last 18 months. And I want you all to think about, and I know you do, but I want America to think about the kind of mental health stress that is putting on our children in America. Many and most of these children are Americans. They were born in this country. Their parents were born in this country. And yet they're afraid. And no one should be afraid. So this administration has really made people feel vulnerable. And then you talk about, those are children. Those are children. Adults have an even better sense of what is going on. No, but this community cannot avoid the hateful and divisive rhetoric that's overtaken the debate in this country for the last year. And the discriminatory policies against Muslims has made it even worse, this ban. So that's why I think I want to talk about all the issues, because I think that the added emotional impact, the added stress of what is happening if you are a Muslim in this country makes it even more important for this discussion to be going on. A recent study by the Institute of Social Policy and Understanding found that Muslims disproportionately feel the negative effect of today's political climate, with 42% of parents reporting bullying of their children because of their faith. That is a horrifying statistic, and one that I speak about all the time and try to get people's attention on. It's unacceptable. We are allowing fear and hatred to divide us in this country. So we have to, in a broader sense, before we talk about the mental health issue, talk about how we're going to start working together to reject intolerance, discrimination, and hate wherever it exists, and to think about what that component is doing to families, mental health in every component. We need to work together to address these issues, but I want to focus now on the mental health. Mental health is something that impacts all Americans. The nationwide statistics are striking, and I'm going to get to those in a minute. But what does worry me, and I talk about this all the time, and I talk about things that have happened in my own family, is the ongoing stigma associated with mental health issues, and quite frankly, I think it's even stronger within the Muslim community. The inequity between mental health care and physical health care is striking. For physical problems, if you get sick, you go to the doctor and you get a checkup. However, most people don't seek out a mental health professional and say, I need help. My father, by the way, it's hard for me to talk about this all the time, but I'm very open. My father was an opioid drug addict. He was a prescription drug addict when I was growing up, before anybody knew what a prescription drug addict was. I lived with the consequences of living with someone who had an opioid drug addiction. And trust me, back then, nobody talked about it. And you didn't talk about what was happening in your families. And I honestly had a sister who suffered from depression and anxiety, my baby sister, who I loved with my whole heart and soul, suffered from anxiety, depression, took drugs herself, alcohol, anything that would ease that depression or that anxiety, because people are afraid to say, even to their parents, let alone a teacher or a doctor, I'm suffering, I'm a little depressed, I'm feeling anxiety, because we have such a stigma on it. I tried to do everything I could to help my sister. I loved her. She ultimately died of a drug overdose. But it's one of the reasons that I will talk about these issues more than most, and it exists everywhere. People are afraid to go get the help that they need, and that's why this conference is so important, and why you all talking about mental health in the Muslim community is so important, because honestly, I think that it's even harder in this community, which is why when we met with the faith-based community, when we met with the imams, it was such an incredible conference. People need to know that they've got a safe space to go to. And you've got to figure out, as you're talking about these issues, how they're going to find that safe space. Raising awareness on mental health training for community leaders is critically important at the local, the state, and the federal level. First 9 years you did the state and the local, and now you're at the federal level. And we've got to keep talking about it, because people don't want to think about it. They don't want to talk about it. There's just this stigma on it. And we're only going to make progress on this issue with the active engagement and participation of leaders like you in this room. And you know what excites me the most? The number of young people that are in this room. I'm not old, but I'm seasoned, and I love the seasoned people in this room. But we need the young people. We really need you to engage and be part of this. Scientists, practitioners, policy experts, and advocates agree. We need to focus on prevention, early identification and intervention, integrated care and treatment, working towards recovery as the goal. These are solutions I believe in, and I'm going to fight for, and you all need to do in your communities. Improving access to mental health care services and reducing the stigma associated with care has got to be a top priority for every one of us in this room, because we simply cannot wait anymore. You know, someone was just saying in the Muslim community, people don't want to talk about it. They don't want to acknowledge that problem's there. And that's why people don't go and get help, and that's how come we see this horrifying problem. We need to say to people, it's okay to talk about it. We need to tell people in the community, put a helping hand out. Tell somebody it's okay, and help get them the help that they need. It's just too urgent for too many people across the country. It's urgent in my community, and it's urgent in this country. The scope of the problem is staggering. 1 in 5 adults, approximately 43.8 million Americans, experience some form of mental health challenges, illness, in a given year. But I don't even like to use the word when I'm talking about mental illness, because it gives people a negative connotation. You know, we kind of lose words that give it a negative connotation and put the helping hand out. Hey, it's okay to be depressed. You got a lot of things that are coming at you at the same time, and let me talk to you about it. How do I help you? Does talk help you? Maybe do we need to help you with something just through this slow period? But don't stigmatize people. Let them know it's okay to talk about it. Children and young people across the country are really being impacted by this. Approximately 20% of children between the ages of 13 and 18 experience serious mental health issues in a given year, and those numbers are worsening every year. Think about these young children that I'm talking to you about right now, who are afraid to go to bed and aren't getting the sleep that they need, or afraid that they or their parents are going to disappear. And that's what becomes the primary thing in their life. Not about learning, not about laughing, not being part of the community, but am I safe? They go to bed every single night wondering if they are safe. These statistics are even more troubling when you put them in the context of access to care. 56% of adults and 50% of young people with a mental illness, mental health issue, will not receive treatment in any given year. More than half the population that needs that helping hand or help in some way, that intervention, will not get it. I've learned that 75% of mental illnesses begin by age 24, yet there are often long delays, sometimes decades, between the first appearance of symptoms and when people get help. Keeping mental health services in silos is keeping patients sick. It's keeping patients ill. Studies show that early intervention is key to bettering mental health outcomes, which has many looking at the opportunity to offer help during the primary care. Furthermore, our nation is experiencing a dangerous provider scarcity. The National Council for Behavioral Health reports that 77% of countries across the country have severe shortages of behavioral health professionals. Many who desperately need help are being left out in the cold. I'll tell you something, I went to, after the shooting in Parkland, which horrifies all of us. It's not just a Muslim mental health issue, but it's a mental health issue in our communities. And the system failed that young man too many times in too many places. But I was at a spaghetti dinner with someone in the community, and they are grandparents. Their daughter has an opioid drug problem, and they are taking custody of their 2-year-old and 9-year-old grandchildren. They don't have a financial problem. They can pay for the mental health services, but they cannot get an appointment. And the 9-year-old has drawn a picture of a knife in somebody, blood drops. They know that this 9-year-old needs help in early intervention. They cannot get an appointment with a psychiatrist for months. Another parent, a couple of weeks ago, I was in Dearborn, had taken, their daughter tried to commit suicide. We really have a problem in our high schools. Beaumont did not, I shouldn't be using a hospital name, forgive me, forget I said a hospital name. I try to be careful when I tell these stories. They did not did not admit her. They gave her a name of somebody to see, and she can't get an appointment with a provider for months. That's a healthcare crisis, and we got to do something about it. I'm scared to death. We all know the emotional toll this takes on our communities and families every day, but it also has a real impact on our economy. Mental health issues are costing America $193 billion in lost earnings per year. People are often forced out of the workforce because they don't have access to simple treatment or therapy that would allow them to have a consistent job. And I'm also really concerned about veterans who are also dealing with mental health issues. 20% of all suicides involve veterans, and suicide rates among veterans are twice as high as they are among non-veterans. These statistics are painting a really grim picture. But that's why you're all here, because you do care, and we got to attack the problems. And we've got to go, and we can fix it if we don't put our heads in the sand, though it's not going to be an easy or quick fix. I was with, last week we had a shooting at Central Michigan University. I'm doing more Michigan things because I'm looking at all my Michigan friends. But these are very real, in the moment stories I'm telling you. And there was a shooting, and I was with a number of the heads of hospitals. I won't tell you the names this time. And but they told me that this young man and he ended up killing his parents. But again, the mental health system failed. He sought help that Thursday night for an opioid drug problem. They kept him overnight, called his parents, but they didn't have a bed to put him in-house, and they didn't have somebody that could stay or help him, and we saw what happened. They told me that last year, now you all may know these statistics because there's some really good academics here, but that no one went in to in-house psychiatry for if someone, is that the right word to use, so that if you were admitted to the hospital, the psychiatrists won't even go into the field that particular, because it's not only because of the reimbursement system, but because of the violence and because of the way that the mental health system in this country has systematically been destroyed after the last few decades, period. And we got to rebuild it. So people like you coming together, talking about these issues, we got to rebuild it, and it's not going to happen overnight. We've got to make sure that people who need help have that helping hand. And I think this community has got even more challenges than some other communities because of the stigma that, not only the mental health stigma, but because what this administration is painting the picture of Muslims. That's just an added stress. I'm never, ever going to let this man get away with it. I challenge him every time I can. So I thank all of you for coming here today, for talking about this issue, just shining a light on it. I hope you get lots of media. I hope we get it out there. I'm honored to celebrate the 10th anniversary, and I look forward to participating in this conference for decades to come, both for this community and for the national community. Thank you very much.
Please give her a standing ovation. It takes courage, commitment. They don't make it like Dingell anymore. And we are very proud that we have them as our representatives.